Hello, everyone. Welcome back to the main plenary room. I'd like to recap some of the discussions that took place in the concurrent sessions because I'm certain you, like me, were faced with having to prioritize your attendance. So, short summaries of each of the sessions. In the Care for Small and Sick Newborns session, we discussed how, even though the ENAP coverage targets have specific national and subnational targets for coverage of care for small and sick newborns, much of the evidence is hard to find, and there is still a major gap for how to proceed and provide with this care, especially across varying contexts. In this session, speakers highlighted in-depth case studies across multiple countries, including Ethiopia, India, Malawi, and Rwanda. They talked about the specific strategies used and the innovations required in each setting, and their vision for achieving the new standards of care for small and sick newborns. So, what do we know? We know that establishing systems for effective inpatient care of the SSNB is feasible. It's not expensive, but it requires a strong policy framework. It requires leadership and champions from national to the community level. It requires human resources, which implies that we build on the experience and success of establishing newborn corners, of task shifting to midwives and nurses, and even the mother. We know that it requires capacity development support, including ongoing mentorship and functional referral pathways. In the second concurrent session, in the stillbirth session, it was clear that despite the preventability of the majority of stillbirths and the increasing recognition of the importance of prevention, progress to end these deaths have been slow. The impact of stillbirths reaches far beyond the loss of life. In all settings, stillbirth profoundly impacts affected women, their families, healthcare workers, and the wider community. Yet, all too often, parents and families are left out of the conversation when planning interventions to reduce deaths and improve care for those affected, and little support is available. Today, in this session, we heard from affected parents about their personal experiences, along with public health professionals, about what is needed from the global MNH community to end these preventable deaths. The third concurrent session, the one on MPDSR, we were able to discuss the recently published scoping review and conceptual framework, but also were able to explore some key implementation lessons. We know that avoiding blame is an important feature of MPDSR, and we were able to explore how this issue manifested in community MPDSRs and how it is being addressed. As we acknowledge the incredibly important issue of addressing the humanitarian context, as Mary Kinney rightly noted, but this resonates across all of MNH interventions. We know that this is a critical area to move forward as the burden is highest in these kind of settings. The WHO and partners are working together to strengthen the implementation of MPDSR to improve health services and preempt future maternal and perinatal deaths. And we can expect future discussions on the topic, including its use in humanitarian settings. Again, like we had mentioned before, all of the sessions will be on demand. So for those of you who couldn't join the other sessions, you would be able to watch it on the page post the forum. With this, I'd like to ask you to help me welcome Dr. David Tereswa, who is a consultant obstetrician and gynecologist at the University Teaching Hospital of Kigali. And David will guide us in our closing plenary, the road ahead. And we will be talking about collective action to accelerate progress and what do we need to do to improve MNH outcomes while providing people-centered care. Over to you, David.
Good morning, good afternoon, good evening, colleagues, friends, MNH community. My name is Dr. David Nhirushwa. I'm a clinician, obstetrician, and gynecologist, and I'm very honored to be moderating the session on the road ahead, collective action to improve or to progress MNH while focusing on patient-centered care. So today, as we know, as we have had through the previous presentation, we are still at a high number of maternal and neonatal deaths despite improvement which have been made. And we do have global targets in 2030, which we all need to achieve. So we are together with two very important panelists. We are very happy now to be having Dr. Harrison Mullen, who works with the Department of Maternal Newborn Health at WHO, to give us her presentation. Dr. Harrison, we are very happy and we are eager to hear from you. Please unmute yourself and give us your presentation. Thank you.
Good morning, good afternoon, colleagues. And thank you very much, David, for the nice introduction. I'm very honored to be here today to be part of this plenary session. And I'm very happy to give an opportunity to talk a little bit about aligning global efforts on maternal and newborn health. And as David mentioned, my name is Allison Moran. I work at WHO in the Department of Maternal, Newborn, Child, Adolescent Health and Aging. And I'm presenting on behalf of a coalition of partners who work with the Every Newborn Action Plan and the Ending Preventable Maternal Mortality initiatives. So just to remind everyone, as we've heard throughout the last 2 days, we know that too many women and babies are dying of preventable maternal death, or preventable deaths, including a large portion of preventable stillbirths as well. And we know that the majority of these deaths happen in low and middle income countries, especially among the poorest families, but the majority are preventable. And we know that investment in maternal and newborn care can save lives. This slide here shows an analysis done using the Lives Saved tool and looking at projections to 2030 compared to baseline levels in 2016. And if we assume that there's 90% universal coverage for the evidence-based interventions we know can save women and children and prevent stillbirths, that about 3 million lives could be saved, almost half of those in Africa. And so you can see the bars there represent the lives that potentially could be saved as a result of proper antenatal care, care during birth, postnatal care for the woman and her baby, as well as for newborn care in hospitals. So investment in this area is critical. We also know that global attention for maternal and newborn health has really increased substantially since the 1990s. And over time, especially with the development of the Millennium Development Goals in 2000, and now with the Sustainable Development Goals, there's a lot more initiatives, both in terms of garnering global attention, as well as attention at country and regional level, as well as efforts to really measure those efforts. And that's what's outlined here in this timeline. And two important global initiatives I wanted to highlight today are the Ending Preventable Maternal Mortality Initiative and the Every Newborn Action Plan. So EPMM, or Ending Preventable Maternal Mortality, was launched in 2015. And not only did the document outline strategies for the Sustainable Development Goal area, but it also outlined strategies for how to really end preventable maternal mortality across 11 key themes that included both proximal and distal determinants to maternal mortality. And we're in the process of developing a roadmap, as well as coverage targets and milestones to help operationalize some of this thinking. In addition, the newborn community has developed the Every Newborn Action Plan, which was endorsed in a World Health Assembly resolution in 2014. And like EPMM, the ENAP Action Plan includes SDG targets for neonatal mortality reduction and ending preventable stillbirths. And coverage targets and milestones were launched at the end of last year. So just to remind everyone, as David mentioned in the introduction, and you've heard throughout this panel, this forum, there are global targets for ending preventable maternal mortality and newborn mortality. And so the global target for maternal mortality is an MMR of less than 70 per 100,000 live births, with the supplementary national target that no country should have an MMR greater than 140 per 100,000 live births. And on the newborn side, the global target is less than or equal to 12 neonatal deaths per 1,000 live births, and a similar target for stillbirths of less than 12 per 100,000 total births. And these targets are included in the SDGs, as well as in the Global Strategy for Women, Children, and Adolescents Health. However, as many noted, we are far off these targets, so we really need to work together to accelerate action. And so just to note that for both ENAP and EPMM, the strategic objectives are very complementary, and both, although they're worded differently and in different orders, focus on reducing inequities, investing in care around the time of birth, as well as for some of the proximal and distal determinants of maternal mortality, like education, clean water and sanitation, looking at universal access and universal health coverage, strengthening health systems, harnessing the power of families and communities, and importantly, making sure that all deaths are counted and there's accountability for those deaths, as well as really improving the quality of the care, as well as the experience that women and newborns receive during that care. So that's the goals and the objectives that we're all reaching toward. And as I mentioned before, they have developed coverage targets that we can look at to track progress towards the objectives outlined in these two initiatives. And so these is the ENAP, or the Every Newborn Action Plan coverage targets that we hope to achieve by 2020. And they look at antenatal care, care during every birth, postnatal care for woman and baby, and for the newborn side as well, improving care for small and sick newborns. Now there is overlap. The EPMM coverage targets are in finalization process, and the first three targets are the same. And the maternal community is also looking at new women who have access to functional emergency obstetric care, as well as the proportion of women who can make their own informed and empowered decisions. So these are in process. Important to note that they look at not only the global level, but also at national and subnational levels to try to really address some of the issues around equity. In addition to these coverage targets, both ENAP and EPMM have developed milestones, and these milestones are outlined here and are very similar across the two different global initiatives. And the idea is that developing results frameworks and work plans in collaboration with countries to try to address and achieve these milestones, which will then hopefully push us toward achieving the coverage targets at all levels to accelerate action toward achieving the ambitious sustainable development goals. So from the global side, what are some of the key messages that we'd like to try to make sure come through during this conference? That, well, healthy mom and baby are at the center of both initiatives. That is the goal we're all trying to achieve together. The focus is on country ownership and impact to achieve the targets so that we can really see progress by 2030. The important role of partnership at global, regional, and country levels. No one can do this alone. It's going to require partnership and all of us working together with a common vision and targets we're trying to achieve. ENAP has been moving along very well, and EPMM is in the process of revitalizing. So the ENAP group is finalizing a results framework based on those milestones I just mentioned, and the EPMM milestones and targets will be launched later this summer. And then we'll be working with 20 priority countries, hopefully, to develop some joint work plans. Preventing stillbirths is critical and embedded in both of these global initiatives. We cannot leave out that important area, and we need to be sure to focus on ensuring that no baby dies prematurely. And essentially, and the key role of this conference and this forum is really looking at how we can align these initiatives as much as possible, but also ensure that we don't lose the important elements that are essential and unique to maternal health and survival, as well as those that are essential and unique for the newborn survival. To really look at strengthening country planning, tracking progress, sharing successes and challenges, and learning together. So as David mentioned, we all have a role to play so that we can have collective action to really make a difference for women and babies. Country governments are essential to ensure we have targets and plans with adequate investment, strengthening routine information systems, and really building resilience that's already started as a part of the COVID-19 pandemic and response. Working closely with our colleagues professionals and academics to ensure everybody's part of the solution. Working closely with women, parents, and caregivers, all voices are essential to move this agenda forward. Working in partnership, as I mentioned before, and finally ensuring we also learn from other success stories through media, religious leaders, celebrities, champions. So thank you very much for the opportunity to share some thoughts with you today.
Yeah, thank you, Dr. Harrison Mullen, for taking us through the global commitment and the global consensus. We know how important these initiatives are, especially making sure that efforts working together, finances are just put together to achieve the target. So as we know, we do have 2030 targets which we have to achieve, and we felt the global efforts might be hard. So, but now we do have an important aspect to consider. This is women's voices, women, newborn, and communities' voices. We know that the quality of care is quite important. However, without them, we cannot be able to succeed. So we are very happy to be together with our second panelist, who is Miss Angela Nguku. Angela Nguku is a midwife by profession. She's really contributed in the patient care, and she has observed and she has seen some cases of women and newborn outcome not good because of some intervention which cannot be done. And from there, she's now a very important advocate for women's voice. She's the founder and lead of White Ribbon Alliance Kenya. Dear Angela, we are so happy to have you, and please give us your talk. Thank you.
Thank you so much, David, and thank you, Dr. Harrison, for such a great presentation, basically laying the ground to see why such initiatives are really crucial and why mothers and newborns' voices still count, and everyone needs to play a role to ensuring that they count. But they can only count when the voice of the mother or the client is basically on the table. And that's why today I'm happy and I'm glad to be sharing with you that one of the most interesting campaigns that I've ever taken part of, and it's a campaign that I hold very close to my heart because it really sparked a revolution where clients, mostly the people who spend time at the MNH facilities, at the delivery beds, have never really been on the forefront. And a lot of times when we talk about quality care or quality and dignity in care, a lot of times it's dictated by the supplier, or me, the midwife, the doctor, and the other healthcare team workers in the health facilities. A lot of times the user is not on the table. And why I say this campaign is really close to my heart is because it gave voice to the people, to the user. It was about the user, the client, the mother being at the core of this all. And so the What Women Want campaign is a campaign that started to spark basically a revolution. I call it sparking a revolution because it was about going against the grain, the usual way of looking at who defines quality of care. And I must say, in Kenya, this campaign was basically led by initiated by the fact that we had just done, or a survey had just been launched in Kenya, which looked at what caused maternal mortalities in this country. And globally, it was because of the Lancet report that looked at quality of care in the SDGs era, and looking at where is the role of the client. And in Kenya, we realized that 9 out of 10 women who had died in 2014 was as a result of poor quality of care. So we sought out to find out, what does quality of care mean to women and girls? And so we went on to the women and girls themselves to understand, what does this mean to them? It's interesting because a lot of times we talk about equity in care, but equity is always dictated by the supplier, the giver of the care. But we cannot talk about equity if we do not have the client at the table. And so this campaign started as a small ask. What does quality reproductive health care mean to you as a woman and a girl? I can tell you that even as we went out to collect this data from women and girls across the different countries, one thing was for sure, women and girls felt like we were playing games with them. They had never been asked this simple question. No one had ever gone to them to ask them, what does quality of care mean to you? And as such, that's why it was important to us. We realized that it was giving power back to the women, power to dictate, to determine what care looks to them. And we were really, really shocked, but again, impressed by what we heard from women and girls. And today, I'm going to present what we heard from 1.2 million women and girls across the 114 countries, mostly of these responses coming from 8 of those countries, mainly in Sub-Saharan Africa and Asia, Kenya being one of them. In Kenya, I led the collection of 120,000 respondents from women and girls across the different divides of the country. The What Women Want campaign was not a campaign like the usual surveys. It was basically asking one question. And we got all sorts of responses because it was an open-ended question. These responses, 7 of them were hard-coded. And at the end of the day, this landed on 39 categories of what we had from women and girls across board. I'm not sure all of you are aware, but if you want to follow up more on what has happened with this, we have just launched a dashboard that I'll be talking about it later on to basically talk you more about what are we doing with these voices that we had from women and girls across board. Looking at my presentation right now, what you see are the key top answers that came out of this campaign globally. It's a campaign that basically gave women the power to say whatever they wanted to say. What does quality care mean to them? And we heard globally that women and girls want respect and dignity in their health facilities. We went further to probe what that meant in terms of what were they saying in the different answers that we got. And we lumped this together to mean respect and dignity based on what we heard from them. Women said we want to be called by name. Women said we are tired of being treated mechanically. We are no longer being considered as people who are players in our healthcare. We go to a health facility and what we get is doctors and nurses writing things down without considering us, without considering what we have to say. I come into the health facility and all what I get is, okay, I've already understood what you're suffering from. This is it. Go to the delivery bed, climb up, do this. They want to be part and parcel. They want to feel that care. Women and girls also told us that they want water sanitation and hygiene. It is not just about running water. What we heard from women and girls is that women are tired of going to smelly toilets, smelly health facilities. Women are tired of sharing beds, or linen having dirt and then they are told to use it. They are tired of going to brush their teeth in dirty sinks. They are tired of sharing beds. And so women told us we want running water. We want clean facilities. We want facilities that can actually speak to what we have come to do in that health facility. Further, the third thing that we had globally is that women want medicines and supplies. And what this meant is that women are tired of seeing their relatives die of bleeding after delivery. Most of them said we want supplies, especially the life-saving uterotonics, drugs that save women from dying after childbirth. They want those supplies. They no longer want to be told, go and buy. More to that, women told us that they want increased, competent, and better supported midwives and nurses. And I'm glad that we are talking about the decade of action, decade of the midwife. Women want midwives who are supported enough to be able to offer the care that they want. The fifth thing that we had globally is that women want increased, fully functional, and closer health facilities. What got us wondering is the fact that for the longest time, when we talk to our leaders, we hear them saying we have constructed health facilities. They are closer to the people. But what women and girls told us that they are not closer economically, they are not closer socially, they are not closer even geographically. Women want more fully functional buildings that have health workers, buildings that have competent health workers, that have drugs, that have people who respect them. And so along the way, we've been going on asking ourselves, what is it that we need to do with this data? And since the launch of that campaign on the International Day of Maternal Health Rights in 2018 to date, we have continued using that data to talk, to advocate, or to push for different changes across different countries and contexts that we work in. So far, we have had over 2 million people mobilized to basically listen and understand what this campaign is all about. We have had more than 20 policy changes focused on the top WW demands, or the what women want demands. Some of those wins have been in Kenya, where I work and where I've seen this campaign take root. We have had 6 country accountability mechanisms strengthened. We have had 5 country resource wins, where countries like Pakistan and Malawi, they have had budgets increased for family planning because women and girls said we want better family planning facilities, better supported health facilities where we can access family planning. We've had over 2,000 health workers hired and promoted. And when I talk about a campaign that sparked a revolution, it's a revolution because previously everything was dictated, decided from the health worker perspective, from the policy maker. But here's a client dictating, what is it that we want? And that tells me much to what are we speaking about going forward. If we're talking about aligning M&H and the road ahead, then we cannot align. We cannot have the road ahead without the client at the center and front of this, because the client knows where the shoe pinches. And so today I'm really delighted to talk about some of these key things that I would really want to see. If we are going to win if we are going to stop seeing the drain or the backward trends that we are seeing, where we have had so many investments talking about MNH, but at the end of the day, the successes have not been there. I would really want to see a decade where all of us have come together, putting the user at the center of it, with our technical sound knowledge, with our donors and funding all geared towards what is really critical, what is really key for the woman, for that girl, for that newborn, if we are really to say we are going to accelerate action and see a reduction in maternal newborn mortality. I think for me, it has been a long way and a long coming, but at the end of the day, what is it that we need to do faster now for us to achieve the 2030 vision and the SDG targets if we are to win this, I call it war because it's a war of fighting maternal mortality and morbidity. Let me talk closely about the dashboard that I talked about earlier. And this dashboard is basically giving the power in words, in women's power, women words. It was launched last week during the CSW 65. And it's an interactive dashboard that you can access it from our website, the White Ribbon Alliance website. And this allows you and me to view women and girls' demands in their own raw words without having to really think about packaging it. What are women and girls saying? And it allows for a truly unparalleled level of access into women's demand by connecting women's voices with the almost infinite possibilities of digital analysis. Please visit that dashboard and see what are those voices, what are those demands that women are asking for, if we are going to make ends meet for them, for lack of a better word. And today I'm calling all of us, as we forge our road ahead, to listen and act and be part of this revolution, a revolution that is going to see the voices of women and girls, of newborns at the center and front of each and every one of us, if we are going really to accelerate progress and ensure that no more women and newborns die in the process of giving life. Thank you so much. Thank you so much.
Yeah, thank you so much for our panelists. And I also want to encourage people who are just following us just to consider putting their comment and the question into the Q&A box on Zoom. So we do have some few questions. And dear Harrison, as we've seen in our opening plenary video, we've seen that with regard to different global targets and especially focusing on EPMM, INAP, we have seen some countries now progressing well and are just in the line to meet the SDG targets. However, some other countries are still a little bit getting some challenges lagging behind. So seeing that all of these initiatives are just endorsed by countries, what lesson can you share with us so that we all go together? We still have some years to come. So what lesson can we learn from the countries which are doing well so that all the countries can just go together to meet the SDG targets, especially by making sure that timely and respectful quality care is just offered and health systems are accountable?
Great. Thank you very much, David, for the question. It's a very important and pertinent question. I think there are many lessons that we can learn from the countries who have made substantial progress and many things that we still need to learn together. So maybe I can just share a few thoughts. We know that the tracking of the milestones for the Every Newborn Action Plan, we've had many important lessons learned, I think, in terms of countries that have made the most progress. And for the countries that have the slowest progress, some of the gaps are still around really having substantial national and especially subnational plans and adequate budgets to really improve some of the gap areas that are identified in the areas that you mentioned. It's really crucial to have national targets, especially for stillbirth reductions. We know many countries are still lacking those targets, as well as the importance of strengthening both quality and respectful care at all levels of the health system through looking at implementing standards for quality of care. For example, some of the work that's being done through the Quality of Care Network in some countries with the highest burden of mortality. Really looking at improving workforce, ensuring there's adequate numbers, mentoring, training, and retention of skilled health personnel. That's really crucial so that there are adequate providers to help provide the quality, respectful care. Importance of promoting engagement with communities, as Angela mentioned, listening to women's voices and really understanding what women need to ensure that quality services are provided, and also working with the community for joint accountability as well. And finally, really ensuring that health information systems are strengthened to really capture the targets that have been set, and as well as the quality of care, so that things can be tracked over time and gaps can be identified and addressed. Thank you. Back to you, David.
Yeah, thank you so much. Angela, during your presentation, you've talked about the role of the voice of women and the voice of the community. And the target and the objective we really need to have is just to make sure that we can reach every woman and every newborn wherever they are. So what do you think needs to be done, not only at the level of the community, but also at the level of the health facility and the policies, just to make sure that inequity is addressed, so that within the next 10 years, we can just be celebrating the success, not only to some few individuals, but to every woman and every newborn? Please go ahead. Thank you.
Thank you, David. I think I'll just echo what Dr. Allison has talked about and point that more towards communities and look at it from an accountability perspective. But I want to take us back to when we talk about the SDG era, we are talking about the era of leaving no one behind. And an era of partnerships. And partnerships can only be created when all of us are on the table. Whether it is in decision making, whether it's in deciding what needs to be taken where, or what policies need to be taken where, or needs to be implemented where. And as such, I would say again that that cannot be done until we collectively and deliberately put all of us on the table to really agree what is really hailing us and what is it that we need to do. And I'm glad that we are here in this forum discussing about looking at what is the road ahead for MNH. And for us to move that forward, we cannot just move it at the global arena alone. We need to move it at the regional arena. We need to move it at the country arena, at the subnational arena, but also at the community arena. What does that mean? That means that each and every one of us, as Dr. Allison has said, has a role to play and an action to take. Whether it is the mother who is seeking that health care, whether it is the midwife who is giving that care, or the obstetrician who is giving that health care at the facility, or whether it is that policymaker who is supposed to make policies that are conducive for MNH in that context. So it's all of us to really come together, or really like it's like a trigger effect where all of us have take ourselves and put ourselves at a space where we need to play a role for us to end maternal and newborn mortality. More to that, I think taking it back now from what I talked about, the What Women Want campaign. I talked about us promising women that we are going to honor their voices by taking this further to where it was needed. And I'm glad that all of us today listening and being part of this closing forum is basically to look at what is it that I'm going to do to act on what women have told us. It is not simple, it's not rocket science. It is simple things like clean water or clean linen. Is that too much to ask? No. I believe it's something that can be done at a very low level without many funds. So it's about what action are we going to take collectively and to ensure that all that reaches the last mile. Because we cannot say that we are going to achieve the MNH targets or the SDG targets if MNH is still lagging behind. We know the place of the mother and the place of the woman in society. And as such, it's all of us to look at what is it that I need to introspect, what is it that I need to do at your different places, in your different spaces. What is it I'm going to do to ensure that that is actually taking center stage? And if we do that way, I can collectively tell you that we are going to end somewhere and we are going to achieve it. It is not a lot that is being asked for. It is the simple things that a lot of times that we overlook, like listening to that voice of that woman and girl to be able to get us where we ought to be. Yeah.
Mm-hmm. Thank you, Angela, for really bringing those practical interventions which need to be done, especially by involving the patient. And also, according to what Allison have said, again, the first question, because she's really focused, she's showing us the success, because we know there are some countries which are doing well, so meaning that even we can all just go together. So now I want to focus on the last question, which is focusing mainly on respectful maternity care. We know that we can just have intervention within countries. We can even encourage women to come and newborn to come and seek care. However, looking at different coverage, targets, which coverage and the target which were presented previously, if we improve our care of women during pregnancy, during childbirth, and postpartum, we can definitely improve the outcome of women and newborn. However, what we see, there's sometimes a lacking piece, which is about the quality of the maternity, the respect for maternity care and patient-centered care. So what do you think we need to do to improve that aspect, so that whoever woman comes to the hospital want to come back the next time? We see women having the first antenatal visit, but deciding not to come back for the second and the third and the fourth, or sometimes even refusing not to come and deliver in the health facility. So what do we have to do? What are the short-term action can we definitely consider, and long-term action can we consider to improve that aspect too as well?
The presentation that I just shared, and the first request, the first topmost request for women and girls was respect and dignity. And if that is what women and girls across the 114 countries that we got this response from, that is their definition of quality. Then if we really run away from it, then we'll not really be doing justice to what we are seeking to achieve at the end of the day. So for me, it's about interrogating again, why did women tell us respect and dignity was needed? Was their topmost definition of quality? What needs to be done? And I think, again, I'll point us towards the dashboard that I just talked about, the raw data that women told us. Women told us issues around being called by name. Is that too much to ask? Smiling when I come to your health facility, explaining to me why you're doing what you're doing to me, encouraging me and telling me what I ought to do, giving me that informed choices to make. Is that too much to ask? It's not women asking for $1 million for them to really go to the health facility. Women are asking for simple, practical solutions to their definition of quality. So if all of us can really go back to ask ourselves, when did the rain start beating us? Why did we stop doing that? And then come up again to see how then do we address this whether it's in a health facility, in a health center, in a dispensary, I think we'll be making strides. So I think for me, it's not calling for such big investments, but investments that seek towards changing our attitude, changing the way healthcare is organized. If a health facility is organized to open for antenatal care in the morning, women told us that is the time they are going to get water in the wells, to fetch water in the river. Why can't we organize that health facility to be opened at 2 p.m. when women are able to attain it? Is that too much to ask? Because at the end of the day, the health facility is supposed to be organized for the client, not the client organized for the health facility. So for me, I think it's about listening again and really taking a deep stand and saying, let's respond to what women and girls have told us as it dictates to respect and dignity.
Thank you. Harrison, anything to add, especially related to accountability? Do you think this also can improve the accountability, maybe, so that we can improve the quality of care we are offering? So
yeah,
maybe what was your say on that, please?
Yeah, thank you so much, David, and thank you, Angela. I completely agree with everything you're saying. I think it goes back to this idea of partnership, and really ensuring that everyone's around the table to really think about what does respectful quality care mean, and how do different actors within the system provide that, right? Because healthcare workers will have barriers, health administrators, district managers will have barriers, women and girls will have barriers. So how do we listen to each other to try to identify some of the barriers and come up with joint solutions, and then ensure that those solutions are implemented across the spectrum among all of those actors? Otherwise, we're not going to be able to really see a difference in reducing mortality or improving the lives of women and babies as well. So we don't want people just to survive, but we want them also to be able to thrive and live happy and productive lives. And so it all comes down to ensuring that diet of the mother and the baby can be happy and healthy. And so what is needed to support that through the improvement? And I agree with you, Angela. I think we have to think also about how to redesign and plan systems that can deliver on those respect and dignity for women and girls and their babies. So thank you. And in terms of your question about accountability, David, I agree. I mean, I think all of us have accountability at all levels to be able to ensure that we work together in partnership across the communities to make that happen.
Yeah, thank you really so much to our both panelists for really taking us through this important aspect to consider in the road ahead. I think if we consider those practical lessons learned and ideas shared, we are just going to reach our target. So now we are just going next to listen to our MNH community who are following us with their questions and comments. Thank you.
Thank you so much, David, Alison, and Angela. It was so very encouraging to hear that all the efforts described put healthy women and newborn at the center, and that there is a collective interest in ensuring that they survive and they thrive. Alison outlined how EPMM and ENAP have both developed complementary strategies and have aligned on global, national, and subnational targets and milestones through 2025. While we review and understand progress as a broader community, my friend Angela reminded us that we need to keep our work grounded in what women want, and that respectful and dignified care is a crucial element in this. The What Women Want campaign has really sparked a revolution this past few years in thinking about what quality of care really means for women and girls. No one had ever asked women and girls what they thought. Now we have data from 1.2 million women across 114 countries. And I really encourage all of you to go and have a look at the dashboard. The audience may remember that when we began our conversation yesterday with the opening panel, which highlighted the need to focus on data, to focus on tracking progress, country priorities, respectful, quality, and equitable care, and how we must work in partnership with one another, it's really helpful to know that these considerations and key themes are really part of the path forward. Therefore, our next two speakers are going to bring the 2 days home for us and really get us excited about the next steps in this movement for collective action. I'd like to start by introducing you to Dr. Jeffrey Smith, who is an obstetrician and gynecologist and a global health strategist with over 25 years of clinical and public health experiences in developing countries across Asia, Africa, Latin America, and is currently with the Bill and Melinda Gates Foundation. And last, but certainly not least, I'd like to introduce you to Anita Gibson, who is the director of the Align MNH Secretariat. Dr. Smith, over to you.
Great. Thanks, Aparajita, and thanks to the Align MNH Steering Committee for asking me to share some reflections at the conclusion of this forum. So as I look back over the last 2 days, I want to focus on 5 A's: acknowledge, analyze, align, amplify, and accelerate action. We certainly need to acknowledge that this forum, at this time, with respect to the time that we're in, we thought this forum would be in person, that we would all be talking about accelerating progress. Yet here we are, isolated from each other, worried about no progress or slowed progress, and managing the effects of the global COVID pandemic. Expectant mothers around the world are also managing the effects of COVID-19 and navigating fear and uncertainty as the pandemic has disrupted maternal newborn health services, maternal and child nutrition programs, and lives and livelihoods. So today we face the diversion of funds to support COVID response and other emergencies, knowing that this could have devastating consequences for mothers and babies worldwide and stall progress for years to come. So Align MNH and this forum come at a critical time. We must be clear in our goals and united in our efforts. We must preserve progress and funding. And as the world drives towards universal health coverage, we must ensure that maternal newborn health remains at the center of these efforts. At the end of the day, as Alison said, we're all here because of one thing: a shared desire to protect the lives and well-being of mothers and newborns around the world. One way that we really serve these mothers and newborns is through my second A, analyze. This forum has helped us to focus on the data, the evidence, the science, and the critical programmatic lessons learned. Align MNH is and will be a way for the global community to come together and collectively analyze our progress, talk about the technical, managerial, and programmatic approaches that will accelerate that progress. This forum is also part of a broader conversation in which many of us are involved about how global health and development are practiced and our roles in that process. As Angela discussed earlier in this session, it's not really about what we want, it's about what women want. And we need to be designing our solutions and our approaches and our innovations to meet the needs of women and the systems that are caring for these women. That reminds me of a formative personal experience that I had when I was training to be an obstetrician. I walked into a patient's room. I was in the outpatient department, and I walked into a patient's room, and she was shocked. She looked at me and she said, "I was expecting a female provider." And I was a bit shocked as well. But then I realized that my responsibility was not necessarily to be the one who provided her care, but to ensure that my patient got the care that she needed and wanted. And as I transitioned to public health, it became clear that I couldn't personally provide care to an entire population that I was working with. And when I worked in places like Afghanistan, be it from gender challenges or challenges due to the fragility of the security situation, we really needed to think about how the system was functioning. So really, it's the whole team, it's the whole system that is needed in order to provide the care for these women and their newborns. We all need to work together to get the system to function effectively. Which brings me to my third point, which is about us working together, align. The Align MNH initiative is just about alignment. It's about improving the performance and the effectiveness of the MNH ecosystem. And that ecosystem is all of us. It's you, it's me, it's Queen and Anshu, it's all of the people who have joined in today. We need to improve the effectiveness of the ecosystem so that countries can more effectively deliver care. So what do we, the MNH community, what do we want of Align MNH? Well, the Align MNH initiative really has three objectives. It's the knowledge hub, creating a one-stop shop where we can go and find critical information so that people can identify the resources that they need in order to do the work. The second is to facilitate and serve as the secretariat for the International Maternal Newborn Health Conference, which we thought we were going to have now, but we have a forum instead. We'll get there eventually. And thanks to the steering committee who really have designed all of this, because the steering committee mostly comes from the countries with the highest burden. And the third area is to provide information and resources to those maternal newborn health technical working groups in those high burden countries, to proactively engage with them. So the presentations and discussions that we've seen over the last 2 days have been amazing. The researchers and the program people working together, experts from all over the world, Asia, Latin America, Africa, working together. The Every Newborn Action Plan and the Ending Preventable Maternal Mortality Strategy side by side, and they look very similar. And that's the way it should be, because the reality is that the providers in the delivery rooms around the world are working together for the mother and the newborn. What's been obvious to them for a long time needs to be unquestionable for us now. We will achieve more as a community when we are working together and aligned with each other. We have more work to do, and that brings me to my fourth point, which is amplify. We need to amplify our efforts. Recall Queen and Anshu's remarks on the first day. As Anshu said, this will really be a decade of collective action for reducing maternal mortality ratios, newborn mortality rates, stillbirth, and improving the well-being of mothers and newborns. Just as we are emerging from COVID-19 pandemic through a combination of science and action, we need a combination of science and action for addressing maternal newborn health. It's a classic public health story. Vaccines don't save lives, vaccinations do. Innovations don't save lives. Innovations that are put into programs at scale do. We need to amplify this work at country level. As Queen said, we need to remove the silos. The mother doesn't benefit from our being in silos. The baby doesn't benefit. The health manager does not benefit when we sit in our offices and only talk about one or the other. You need to think of them as a diamond. We need to take the best in science and evidence and make it real and impactful at the country level. And that brings me to my fifth and final A, which is accelerating action. How can we accelerate action? Although the proverb says, if you want to go fast, go alone, I believe that by going together, we actually can go faster. Because with many hands, the work is easier and the reach is wider. A great example of this is the Align MNH Steering Committee, which is comprised of nearly 20 people from all over the world, many of whom you've heard speak in the last 2 days. They are the people, together with the Align MNH Secretariat, who have really accelerated this forum and made it happen. They've set the agenda, selected the speakers, and designed this forum. Together, they've made this journey easier and accomplished more by working together than any one person could have done alone. I wish we had been together, and we will, I hope, soon. This initiative of Align MNH is just getting underway. All of us, this community, has a 2030 goal, and we intend to push hard together to achieve that goal. So as Anita will tell us in a moment, there will be opportunities for us to collaborate, to learn, to share, and energize, so we can get back to the important work of reducing maternal and newborn mortality and improving the lives of women and children everywhere, together. Even with many challenges that face us, I have great confidence that we can acknowledge, analyze, amplify, align, and accelerate action together. Thank you, and now I'd like to turn it back over to Anita.
Thanks, Jeff. Really appreciate your reflections and emphasizing the importance of us coming together. My role in the next few minutes is to outline some opportunities to do this through Align MNH in particular. And for those that I've not yet had the pleasure to meet, I'm Anita Gibson, Director of the Align MNH Secretariat. I'm not Jeff's 6th A. One of the many things that excites me about this initiative is that we're about sharing the evidence, the science, and the programmatic experience in multiple ways. As Jeff mentioned, we're about knowledge sharing through convenings. We're about knowledge sharing by engaging with country stakeholders. We're about knowledge sharing through online access to learning and resources. We're about all of these things reinforcing one another. So I'm really excited about the potential here. So let's talk about the convenings. And what does this mean for us after today? Clearly, we were only able to scratch the surface on a number of issues, but hope we really sparked an interest in more learning and sharing. As Jeff and others have mentioned, this is about creating a movement together. Jeff mentioned the International Maternal and Newborn Health Conference. This will be a biannual conference to bring the community together. Think of it as a drumbeat to 2030 and as a point of inflection every couple of years for the community to review our data, examine trends, share the state of the evidence and our latest programmatic learning and chart progress. These will also be opportunities to learn about upstream research and innovations. We want this to be an opportunity, particularly for countries, to discuss promising approaches and seek inputs to address constraints to progress. This is about action. While we continue to monitor the course of the pandemic and consult with experts on mass gatherings as well as our government colleagues, I'm pleased to announce that we're planning for the inaugural conference of this biannual series to take place from the 8th to 11th of May, mark your calendars, in 2023 in Cape Town, South Africa. We're grateful to the government of South Africa for their partnership as we embark on this biannual conference series. So some of you might be thinking, 2023, it seems far away. Well, it is and it isn't. It is if we think about the clock ticking to 2030 and all of the rich learning and evidence that must be shared in our community. Clearly, we can't wait 2 years. And we will use smaller convenings and other online platforms to keep a conversation going, including another forum in April of 2022. On the other hand, it isn't far away if we want to design really meaningful scientific tracks and host multiple discussions encouraging us to work differently. Clearly, the current environment has taught us new ways of doing business, so we anticipate that this conference will be designed both with in-person opportunities and virtual engagement opportunities in mind. So what does this mean for Align MNH over the coming months, and how can you be involved? So I want to highlight 3 ways we would like your input that involve, first off, an event survey, secondly, participation in subcommittees, and third, contributing content to our Knowledge Hub. So first, please respond to our event survey. You'll receive a survey soon asking you both about the event itself, but also about what questions and issues are still top of mind for you. We'll seek opportunities to really build on the debates and kind of hot topics that have been identified during the course of the past couple of days. Please let us know what you think. We certainly have ideas on what to do. Our amazing steering committee will certainly have ideas on priorities. And there are some very local global partners who also have ideas on what we should do, but we want to be grounded and anchored in what we are hearing from the broader community, particularly those of you working in and based in countries which must accelerate progress to reach the SDGs. Second, join a subcommittee. We will be forming subcommittees related to the conference and other aspects of our work, and there will be ways for partners to get engaged. So stay tuned for more details, which will also be shared via our website. And speaking of our website, the third option to get engaged right now is to become a content contributor. And hopefully you were able to see that we've started to build content on our website around the issues highlighted here at this forum. And results from our design process reflect that many of you are feeling as there's not a lack of resources that are available. If anything, there's a bit of an information overload and a desire to improve access to online content. Align MNH would like to serve as a facilitator of sorts, helping you find the technical information you need. We're incredibly thankful to those of you who have participated in our global survey as part of our design process, and wanted to give an added thanks to those of you who opted into our discussion groups. What we do in the coming months will be informed by these insights, the post-event survey, so please fill it out, guidance from our steering committee, and discussions with groups who are already very actively engaged in sharing learning amongst partners. We are really here not to duplicate, but to amplify what's happening in the community. So the last thing I'd like to say is that our success is really anchored in building a sense of community. I mean, we can't work collectively, we can't work differently without this sense of community. And so, as Queen Dubé encouraged us yesterday, the time is now. And on behalf of the Align MNH Secretariat, I'm really excited about the possibilities of what we can do together. Thank you.
Hey, Dr. T, welcome back. It's been an interesting and whirlwind of... I was just saying that what an interesting 2 days it has been.
Really, what an incredible moment. I think, for us, at the back end, being part of the steering committee, it's really just been so encouraging to see the incredible community coming together around maternal and newborn health, and really just enriching all of us with all of these dialogues and discussions.
Yes, and I join you in thanking all the speakers, in thanking all the participants. And I'm sure that you all are just as excited as I am for this really required movement for collective action. The road ahead will be a journey for us. It'll be a tough journey for many of us, but I'm inspired by what we have heard these past 2 days. And equipped with this knowledge, the evidence, and the platforms, I believe that we can truly accelerate progress towards the SDG targets.
And you know what excites me the most is that the International Maternal Newborn Health Conference will be held in May 2023 in my home country of South Africa. And I look forward to many conversations and welcoming all of you to South Africa in 2013 and of 2023, and also to the many conversations in the interim, and ultimately welcoming you so that we can meet in person, roll up our sleeves, and continue to get the hard work done.
Yes, thank you for talking about the next conference in South Africa. I'm very much looking forward to that, and also looking forward to the second forum of the Align MNH Collective around this time next year. Align MNH and partners will, in the interim period, continue to exchange knowledge, speak to each other, and really carry on this dialogue about these really important issues. So I know that, right now we have been brought together to say goodbye, but Dr. T, this isn't really farewell, is it?
Not at all. This is really just the beginning. And thank you to all of our government partners, our speakers, and of course our attendees for being part of this wonderful opening forum. And please continue the conversations immediately following this session by joining our networking rooms, and stay tuned for more info from the Align MNH community. It's goodbye from me.
Farewell and thank you. Stay safe, everybody.